So I thought it was pretty interesting. I wanted to talk about football injuries again. I know I've written an article about it, but I was looking at the Seattle game, and Russell Wilson had an injury during the game where he hit the hand of another player when he was following through with the ball. And when I looked at it, the finger was really kind of drooped down, and my immediate thought was, okay, he has a mallet finger. A mallet finger is when you tear the tendon off the tip of the finger so you can't straighten it. So it's kind of like you have droops down, and that's kind of where it gets its name. Kind of looks like a mallet. So the thing is, with the mallet finger, it can be completely tendinous, meaning that only the tendon ruptures, or it could be that the tendon rupture rips off with the piece of bone. And so the interesting thing when I was looking at it, I was kind of thinking to myself, okay, well, if this is the case, then what they should do is tape the finger straight and then see if he can throw, because ultimately the treatment for a mallet finger is just keeping it straight for about 6 weeks and the tendon heals. But this is the key and one of the things that I mentioned in my article was that when you have these quote unquote jammed fingers, it's hard to tell exactly what's going on. So just looking on the TV and all the replays, I could see what I thought was a mallet finger with what we call a swan neck deformity, meaning that there's kind of a hyperextension at the PIP joint, or the knuckle, a little more closer to the. So that's what it looked like to me. And then looking at the media reports afterwards, it was the fact they said that he had a PIP, fracture dislocation, which is a completely different injury, but I could see how it could cause that deformity as well. So in other words, and this is kind of the point that I wanted to make with it, this injury, that, one thing I didn't see them do on the sideline was get an x-ray. There are a lot of portable machines. OrthoScan has a good one. It's the mobile DI. There are lots of different versions, but literally it looks like one of those old projector machines, and it doesn't take a lot of space. Just get an x-ray and see kind of what's going on with that. There's definitely, if you notice fracture dislocation, really at that point, the game is over. Of course, theoretically, you could play through the pain and get it fixed afterwards, but it's kind of like with the guy with that kind of contract and everything, that doesn't seem like a good thing to do. So anyway, but the fracture dislocation, that's like a whole different ballgame. So in terms of difficulty of fixing those injuries, of course, some of these can be straightforward and put some pins. Some of them you have to open and fix. Some of them, they're devices such as the turnkey device, which is basically a dynamic external fixer, which I found is something in my arsenal that really has helped save me with a lot of these injuries. But I realized that an injury like that potentially could be, season ending. And if it's not really kind of managed well from the beginning, which I'm sure it is, can cause a lot of problems. The biggest one of which would be just finger stiffness. And so that was a lot bigger deal than just kind of what I saw on TV. And that is the point of kind of my even bringing up the subject, that I see a lot of football injuries. I see a lot of people that play through things for an entire season. They show up at the end of the season, hey, doc, can you fix me? And sometimes the answer is yes, and sometimes the answer is no. So it's one of those things where it's a very simple thing to just kind of, look at and get it fixed. Now, I understand, most of these things can be taped up and you can put them back in the game, but you have to know like what you're dealing with. And I think one of the simple things, having a x-ray device, like for example, our mobile van has x-ray equipment. So when we go to the high school games, we are able to look at these things and tell whether or not this is something simple, if you can play through it or not. But looking at how that was handled was very interesting. I'm also interested to see what other type of injuries. Every year in the NFL, there's bad injuries. I tend to focus on the hand injuries, although some of those bad ankle fractures and like Dak Prescott and things like that, I pay attention to those because really, I know what it takes to fix those things and the potential complications. And when I see them get back out in the field, I know that it did a really good job. But really, the true recovery for those injuries like that is 12 to 18 months. I mean, and they're back out in the field, much sooner than that. So, there's a lot of work that goes into that. But getting back to the finger, I think the point is that the jammed finger situation can be a very simple one or a very complex one. And just recognize that we really have to be able to take a look, particularly with x-ray and advanced imaging, to see exactly what's going on. And some of these things are really like problematic. Fracture dislocation of the fingers tend to be pretty problematic in terms of being able to get the motion back and pain-free use. So It's a big deal. And I think that if I could give a message to younger athletes, really, it is to not play through those things, to really get it checked out. Or if you played through it, get it checked out immediately after the game and just kind of see what's going on, because we don't really know by just looking at it and taping it up. If it's just a jam finger, meaning a bad sprain, or if you have a fracture dislocation or a simple tendon or ligament injury, you can't tell by just looking at it. So I think that's important. I'd be interested to hear about any bad injuries any other hand injuries in the NFL or sports that may have been public. So I like taking a look at those to just kind of see exactly what I would do to treat them, and kind of also look at what their recovery is. So I'm interested to see if you've seen any other interesting injuries in football, but they can be otherwise. But a lot of times they're more publicized in football recently, particularly of the hand and upper extremity, that we can look at and discuss. Thanks.